It always begins the same way. Two people, young, excited, full of dreams, believing love will automatically teach them everything about intimacy. They think passion will guide them, instincts will protect them, and mistakes can't possibly happen because they love each other. But in reality, sexual health mistakes are like silent traps hidden in a dark room. You don't see them. You only feel their impact when something goes wrong. And one fact shocks most couples when they hear it for the first time. More than half of young couples make the same sexual health mistakes without even knowing they are mistakes. These mistakes don't just affect pleasure. They affect hormones, fertility, emotional bonding, and long-term health. And the suspense is this. These mistakes begin small, almost innocent, but over time grow into problems big enough to shake confidence, relationships, and physical health. I'm Dr. Ayurmoolam, and today we are entering the unseen world of what young couples do wrong in sexual health. Not because they are careless, not because they lack feelings, but because no one teaches them the truth. No one guides them on how the body works, how the mind reacts, and how small habits today can become big complications tomorrow. This topic matters because relationships today are fragile, not due to lack of love, but due to lack of understanding. Fear, confusion, guilt, poor communication, wrong timing, incorrect methods, unrealistic expectations, hormonal imbalance, premature exhaustion of the reproductive system. These are mistakes I see daily in clinics, and every mistake has a story behind it. I want you to imagine a couple. They look perfect from outside. Smiling selfies, romantic dinners, beautiful chemistry. But behind closed doors, the story is different. He feels pressure to perform. She feels shy to communicate. Both pretend everything is fine, but both carry questions they are scared to ask. Nights feel tense instead of romantic. Days feel emotionally heavy, and the silence deepens until it becomes a wall between them. This wall is not built in a day. It grows from repeated mistakes they never recognized. The symptoms of these mistakes appear slowly. Couples often come with complaints they can't explain clearly. A girl may say, "I don't feel connected anymore," or "I feel pain, but I thought this was normal." A boy may say, "I don't know why I lose erection sometimes," or "I feel tired and stressed whenever intimacy comes close." Some experience low desire. Some feel too much pressure. Some face dryness. Some face performance anxiety. Some have guilt. Some have fear of pregnancy because they rely on unsafe methods. Some feel emotionally distant even when physically close. Some experience infections because they ignored hygiene. Some experience irregular cycles because stress has quietly taken control. And some experience infertility signs long before they think of planning a baby. Doctors observe patterns. A woman's body may show signs of hormonal imbalance from chronic stress. A man may show signs of premature ejaculation due to anxiety. Their communication may be poor, their expectations mismatched, their fantasies suppressed or hidden, their understanding of protection methods weak, and most importantly, their belief that sexual health just happens naturally becomes the biggest source of trouble. After listening to hundreds of couples, one thing becomes clear. Most young couples struggle not because of sexual dysfunction, but because of sexual confusion. Let's go deep into the root causes. Science tells us that sexual health depends on hormones, emotions, blood flow, nerves, and psychological readiness. But young couples often assume that attraction alone can control all of this. They underestimate the impact of stress. They ignore biological signals. They assume porn-like performance is normal. They think expressing discomfort will offend their partner. They think contraception can be figured out later. They think lubrication is optional. They think lasting longer means masculinity. They think silence means understanding. But biology doesn't work on assumptions. Medical science explains that stress increases cortisol, which reduces testosterone in men and disturbs estrogen-progesterone balance in women. This leads to low libido, poor erections, dryness, irregular cycles, and low energy. Lack of sleep disrupts melatonin and sex hormones, reducing pleasure response. Poor diet reduces blood supply and hormonal function. Overthinking activates the fear center of the brain, killing arousal instantly. Hygiene issues cause infections. Wrong timing creates pressure instead of pleasure. Lack of warm-up causes pain in women. Rushing intimacy confuses the nervous system. And using withdrawal method leads to repeated pregnancy scares or actual pregnancies because pre-cum can carry sperm unpredictably. Ayurveda adds an even deeper explanation. Intimacy is governed by Shukra Dhatu, the purest form of energy. This Dhatu is strengthened by good digestion, calm mind, balanced lifestyle, and emotional bonding. When couples rush intimacy without emotional alignment, Vata imbalance increases, causing anxiety, dryness, and fear. When couples fight often, Pitta rises, causing irritability, heat, and early discharge. When couples suppress feelings, Kapha rises, causing low desire and heaviness. Ayurveda also explains that excessive sexual activity at a young age weakens the Dhatu over time, leading to fatigue, hormonal imbalance, and reduced fertility later. Many couples don't realize that reproductive energy is not unlimited. It needs nourishment, rest, and balance. Now let's walk into diagnosis. When couples face repeated issues, they often come with fear in their eyes. Diagnosis starts with listening, understanding the emotional story. Then we ask medical questions. Is the woman experiencing pain? Is the man experiencing erection issues? Are they using the right contraception? Are they communicating? Is there guilt or trauma? Depending on symptoms, tests may be needed. For women, we sometimes check hormones, like estrogen, progesterone, thyroid, prolactin, and a pelvic exam if needed. For men, semen analysis, testosterone levels, and stress markers help understand the picture. In cases of infections, swabs or urine tests may be required. Psychological screening helps identify anxiety patterns. Ayurveda assessment evaluates digestion, sleep, stress, and dosha imbalance. Couples should consult a doctor when issues repeat, when pain is present, when performance anxiety becomes chronic, when emotional disconnect grows, or when intimacy starts feeling like a burden. Now we enter the part couples find most helpful: solutions. Let's begin with diet. Sexual health is built in the kitchen long before the bedroom. A diet rich in antioxidants, healthy fats, nuts, seeds, fruits, and ghee improves reproductive energy and hormone balance. Almonds, walnuts, dates, raisins, eggs, spinach, pumpkin seeds, pomegranate, figs, and warm milk with saffron or ashwagandha support vitality. Avoiding junk food, alcohol, excessive caffeine, and late-night heavy meals helps prevent hormonal disturbance. Couples should avoid staying hungry for long periods because low glucose kills arousal and increases irritability. Hydration is also essential because dehydration reduces natural lubrication and energy. Exercise plays a critical role. Many couples underestimate how movement affects sexual health. Regular walking improves blood flow. Strength training increases testosterone in men. Yoga improves flexibility, reduces stress, and enhances pelvic energy. For women, hip opening yoga poses reduce pain and increase pleasure response. For men, pelvic floor exercises improve stamina and erection control. Deep breathing reduces anxiety during intimacy. Meditation improves emotional bonding because it calms the mind and allows hormones like oxytocin to flow naturally. Couples should avoid intense exercise right before intimacy, as fatigue can reduce performance. Medicines and supplements depend on the cause. Ashwagandha supports stress reduction and improves libido in both men and women. Shatavari supports hormone balance in women. Gokshura enhances vitality in men. Vitamin D, zinc, magnesium, and omega-3 supplements support reproductive health. In cases of hormonal imbalance, targeted medicines may be needed. For dryness, lubricants can help, and they reduce pain significantly. For infections, proper antibiotics are required. For psychological causes, therapy or counseling may be needed. Ayurveda medicines like Chandraprabha Vadi, Brahmi, Jatamansi, or Manasmitra Vatakam support emotional balance, reproductive strength, and nervous system stability. Lifestyle and Ayurveda tips are where real transformation happens. Couples need to sleep on time. Hormones repair at night. Late-night scrolling harms sexual health more than most people imagine. Warm baths relax the nervous system. Avoiding porn helps reset expectations. Gentle communication builds trust. Non-sexual intimacy like cuddling, holding hands, and talking openly improves emotional safety. Ayurveda recommends Abhyanga, a warm oil massage, to relax nerves and improve reproductive strength. Drinking warm water throughout the day improves Vata regulation. Having a screen-free hour before bed creates natural intimacy instead of forced interaction. Respecting each other's pace prevents fear and builds desire. Avoiding resentment and silent treatment is essential because emotional conflict directly reduces physical connection. Let's simplify with do and don't lists. Do talk gently. Do warm up slowly. Do use protection. Do prioritize hygiene. Do express discomfort respectfully. Do build trust gradually. Do maintain health. Don't rush. Don't compare with porn. Don't hide infections. Don't use unsafe contraception. Don't shame your partner. Don't hold unrealistic expectations. Don't ignore emotional or physical pain. Preventing long-term issues is easy when couples build routine. Wake up early, eat nourishing food, avoid extreme stress, keep physical activity regular, build emotional connection through shared activities. Create intimacy rituals, like talking for 10 minutes before sleeping. Keep your bedroom calm, clean, and screen-free. Respect rest days. Understand that intimacy is not a performance, but a connection. A couple that maintains emotional and physical balance in daily life rarely experiences severe sexual health issues. Now return to the young couple we imagined earlier. After weeks of guidance, their story changed. Their nights turned peaceful. Their connection deepened. Fear left their eyes. They realized what many couples never understand. Intimacy is not built by hormones or passion alone. It is built by knowledge, patience, communication, and health. Their story transformed because they understood their mistakes. And when mistakes become lessons, relationships become stronger. Sexual health mistakes are not signs of weakness. They are signs that learning is needed. When couples understand their bodies, they unlock their best relationship. When they correct small habits, they prevent lifelong issues. When they respect each other's pace, they create intimacy that feels safe, exciting, and fulfilling. If this explanation helped you, make sure to like the video, share it with someone who might benefit, and subscribe to Dr. Ayurmoolam for more practical, clear, and honest health guidance.